We are back. This is the Now Morning Show. So good to have you on the program with us, wherever you are, guys. We're really happy that you are here with us. And with the continued increase in cases of COVID-19, we check in now with the team at PAHO. Joining the conversation this morning is epidemiologist and member of the PAHO Incident Management Team, Dr. Eldona Boisson. Good morning, Dr. Boisson.
Morning, Lisa. Nice to be here.
Good to have you once again. And you know, we have crossed 1,000 cases. We're at 1,007 now. What are your thoughts on the steady increase in cases that we are currently facing, especially in the past week or so?
Okay, so what has happened has not been so different to what has taken place in some other countries, where when measures are relaxed, and we have started to relax measures, opening up our economy, and trying to open up life as we do it. And it's really not uncommon. We've seen it in other cities that you do see an increase in cases once that starts to happen because people start gathering and mingling.
Yeah. So is it that we should not be too concerned about the increase? Because, you know, in circles, you're seeing people on social media, wow, that's such a big increase to go to 1,000 persons in over a week and a half. And is it that we should not be as concerned now with the numbers as they're increasing? And we're even seeing, you know, the UK putting us on a list of, you know, having to be quarantined coming from Trinidad and Tobago and so on. Should we be that concerned?
I would say it is cause for concern. I mean, yes, we're going through a second wave. Our second wave is bigger than the first. Again, it's not necessarily an unusual thing. So I wouldn't say it's not cause for concern. I think that would be a little flippant of me to say that. People obviously will be concerned. We live here and we see cases going up. But what we really need to be thinking about is how to protect ourselves. The fact that we have more cases and we have community spread, what it means is each of us is at increased risk of exposure. That doesn't mean if you're exposed, you have to be infected. If you protect yourself, you can be exposed and not be infected. So that's what we should be doing. Yes, there's cause for concern, and to understand that now we need to do what we have to do. The government has to do what it has to do to reduce our risk of infection. And if I may, just to remind people what we need to do, first of all, sick people need to stay away from other people. If you're not going to hospital, isolate at home. Otherwise, these are your healthcare providers who need help here. When you are going out, you want to maintain a physical distance of at least 1 meter. The government says 2 meters, that's perfectly fine, it's more than 1 meter. You also want to wear your mask when you're in places and open spaces where you cannot physical distance. Frequently wash your hands because that will kill the virus, or use a sanitizer. And definitely don't put your hand into your face. Hard to do because we're used to doing that, scratching our nose and different things. But that is where the virus enters, in your nose, mouth, and eyes. Even if you have contaminated hands, you don't put them in your face, you still protect yourself.
Dr. Warsaw, good morning. I have a question. With regard to the cause of the spike in infections that we're seeing now, is it attributed more so to the gathering of people and the lack of physical distancing in some cases, or is it more so because of secondary means of infection, such as touching a doorknob that may, someone with an unwashed hand may have touched that had COVID-19 and the like?
Okay, so that's $1 million question, and I don't have the answer. I don't know that anybody will ever have the answer. But what we do know is that the outbreak, this disease is mostly spread from infectious persons sneezing and coughing. So by that direct propulsion of droplets from persons. We do have evidence that persons can become contaminated if they touch contaminated objects and then put their hands into their faces. But it is mostly driven by ill persons, spreading usually starting from about a day before they become ill with symptoms up to the first sort of 2 to 3 days afterwards. That's when they are most infectious. And that is really what the outbreak is driven by, for the large part.
When it comes to the figures of contagion and mask wearing, what is the efficacy of the mask as pertains to if an infected person is wearing a mask versus a non-infected person wearing a mask, and then in public amongst those who are not wearing masks versus those who are wearing masks?
Right. So it's a package of measures that you need to take. Mask wearing is one of them. We do not have efficacy measures for cloth masks because, of course, there's no standard for the cloth mask.
Right.
And we don't know what everybody's wearing. Everybody's wearing something different. Medical masks, we know, are well over 95% efficacious. And this is why healthcare workers use those. But healthcare workers are exposed to a different level of risk. They are definitely going within that 1 meter space of sick people because they cannot treat them otherwise. In the community, you're not continuously exposing yourself necessarily to sick persons within a meter because you're combining the physical distancing, and also not every single person that you meet would necessarily be infected. So I cannot say for the mask, any barrier will give some level of infection. To put a percentage in it is really impossible because we have no standard mask like how we do for medical masks.
Dr. Boisseau, last weekend the Minister of Health spoke about reverting COVID cases from community spread to cluster spread. Exactly how would that work?
So what has happened now, community spread is the highest level of transmission risk. It's basically saying that it's in the population, anybody could have it. We don't know where it is and everybody's at risk of exposure. It's the highest level. Clusters is one level down, meaning there's some of it there, but there's not widespread. And then sporadic is even a lower level. So we moved up, now we want to do a move down. How that will work is that governments, as well as the population, by taking the precautions that the government has put out for us, will need to try to limit their exposure by not going into crowded places, not going out as much as you can so that you limit exposure. And if you do, physical distance, mask, hand washing, and so forth, to limit your exposure, to reduce the number of new cases, to reduce your contact with cases so that the numbers come down. And then eventually when the numbers come down, the idea is that now you have it down to low numbers where you can detect if you have cases popping up and you can shut them down. So that is how that would work. And what we have seen in other countries is that because the virus is out there, they will go through continuous waves of relaxing and restricting measures depending on what transmission category we are in. Because unfortunately, it's not just a health issue we have to think about, but an economic issue. Without economics, we cannot even finance health.
Yeah.
So that balancing of lives and livelihood has to keep going on, because if there's no livelihood, we cannot even finance the health to save lives.
Yeah, we were actually speaking about that earlier. We have just a few minutes, but we have a question from a member of the public. It takes us in a different direction. Can you tell us if there's any relation between smoking and vaping and the spread of the virus?
We don't have any evidence about smoking and vaping and the spread of the virus, but we don't need to have that to tell people that secondhand smoke is bad for you in many, many ways. So you would want to stay away from that anyway. Mm-hmm. We don't have evidence, but it may come to light. Research goes on every single day. But what I can also tell you is that people who smoke and vape put themselves at an increased risk of having severe disease should they become infected with COVID.
Right. Yeah. Well, Dr. Boisseau, thank you so much for spending time with us this morning and explaining to us those various issues there that were at the top of our tongues as we started the morning show. And that was epidemiologist and member of the PAHO Incident Management Team, Dr. Eldona Boisseau. Once again, thank you and keep safe, Dr. Boisseau. All right, guys, we're going to take in a few messages. Come right back here on the Now Morning Show after this.